for certain things, certain cases. Like I had this case and I did this thing and it worked. And they extrapolate it to everybody. My comment is always, what does that do physiologically? Not in a negative way, positive, right? And I've made these models in my head, you know, and those models have helped me be able to judge, does that fit the model, right? Mm-hmm. Does that fit in the model that I'm trying to accomplish? Does that change the physiology in the way I want to in this instance? And so that's where I come from. My diagnosis is kind of irritating, very irritating to me, because we want to put a name on it and we'll call it and the diagnosis never tells you what it really is. It's the name of a guy, or it's or it's some gimmick, diabetic neuropathy. Why did they call it that? Okay, because of diabetes, you know, the diabetes is killing the nerves. But why do they call it diabetic neuropathy? Marketing. Has nothing to do with the solution at all. Has really nothing to do with the physiology, except for, okay, I know the nerves are dying because of diabetes and not alcoholism or some other toxin or whatever. Or some genetic disorder, you know, like Friedreich's ataxia. There's another one, Friedreich's, okay. But that one does help because it's genetic.
I'm so glad you said that, because every time I get diagnosed, I get put into a pigeonhole, and these are the meds, these are the things, and I'm like, but you know what, I have a little bit of Parkinson's and a little bit of dystonia and a little bit of dementia and a little bit of this and a little bit of that, and my body's falling apart. And I think that if my body had structure, everything else would work.
Yep.
It's not disease, it's dis-ease.
Yes.
Fix it.
Yes.
You know, and everybody's like, nah, we're going to drug you up and medicate you and shoot you up and put a brain implant stimulator, which, you know, that's great and wonderful, and thank God, because that helps so many people. And I don't want to just say, it's not for you. Definitely not for me. I've tried all three. Meds make me suicidal. Brain implant stimulator is a TENS unit that does not stop, and it's just like, God, I'm going to need a person. Stop. And so then the Botox injections, well, for one, needle phobic, but then they put the needle into your nerve to hear. It's a microphone to listen to where is the whooshing. Then the computer gives you an injection there. After time, well, I have it over my full body, so you think I'm gonna last with shots over my full body when I'm like, don't even give me a vaccine, and that's not gonna be good. But then it causes atrophy. So after every 3 months, I have to continue this program. Well, in 7 years, I'm not gonna be able to hold my head up on my own, because I'm gonna be so atrophied. I'm gonna be Jello in a baggie, and I'm melted. So this is, you're my 12th neurologist, literally 12th. And you're the first one who said, well, let's blow on your eye and suck on a popsicle stick.
That's right.
And so it works. And so I'm just pissed off at everybody out there, all the medical community, and I feel bad for the doctors that are spending all this money on all this education, and they're getting gaslit.
I know. I to their defense, I often, you know, people say, yeah, but I say, no, these are sincere people. They're just all taught by the same people out of the same books, and they say, well, no, it's a different book, because how they plagiarize each other, right? They're all teaching, and then you go to the internet, they're all teaching the stuff that they want you to hear. It's stuff that we've been talking about for 100 years, you know, and we've known that it hasn't worked. The science, neurology is 40 to 50. When I say neurology, neuroscience is 40 to 50 years ahead of neurology. I have made a habit of, when I find great researchers in neuroscience, man, I read everything that they've got, and I am just absolutely amazed at, you know, the stuff that we've known for decades, you know, that these Nobel laureates have been putting out, and I'm going, it's not reflected at all. We've got a medical school, Toro, it's a DO school, and they've got a guy who's the head of the neurology department, and he did this big full page spread in the newspaper, you know, about autism. And so I read it. A patient brought it to me. I don't read the paper. I don't have time to read that. Pravda. And so I'm reading this thing and I'm going, that's 30 years, that's what we know 30 years ago. And I'm going, no. And he's saying that anybody, and this is what it was all about, anybody that says that they can help with autism is a snake oil salesman. And I'm going, that's not what they say with Autism 1. And that's what I asked the experts, right? Well, I'm an expert, really, in what? Neurobehavioral disorders. Cool. Hey, I love that. Have you ever heard Autism 1? They go, what's that? I go, we can't even have a conversation. That is the group on the planet with the premier research. They are the gold standard in research on autism. And they are saying it's a developmental disorder, so we should be able to develop our way through it. And nobody even hears that, right? And so this guy, and he's the head of the neurology department, and I go, and he's in charge of our newbie doctors, and they're just coming out, there's nothing you can do, here's your meds, here's your meds, here's your meds. 4 years later, they got tardive dyskinesia, and then they're softening it so they're not getting sued for the damage to the brain that will never be undone, right? Can we stop the inflammation? Well, it's kind of like an autoimmune, so there are things that we can do to soften it, but it's damaged. Once it's damaged, all my brain injuries are there, right? I can't eat a panda. If I eat a panda,
oh, because it crosses the blood-brain barrier, it gets into your brain, causes extreme inflammation in the brain, and
reconcusses me.
Worcestershire sauce.
Melissa does that too. Melissa does that.
The Worcestershire sauce.
I want her to say it just so I can listen. Yeah, those things are, well, what is it? MSG. I go to.
But we don't have MSG anymore.
Exactly.
We've eliminated MSG.
I go to the front, and they say, yeah, what would you like? I said, a glass of MSG and a straw, please. And they go, we don't do MSG. I said, I understand you don't, but the food that gets here already has it on, because I'm going to eat, and in about a half an hour, I'm going to be psychotic. I'm going to be so pissed off. I'm going to have a massive headache, and you don't want me coming back here.
I'm not alone.
Yeah, and because it reconcusses us. And so I have to be very, very careful. What is it? Monosodium glutamate. Why glutamate? Glutamate is the number one neurotransmitter, excitatory neurotransmitter in your brain. So why wouldn't it engage it and kick things off?
So anybody that's had multiple concussions in their life, young person, healthy brain, just, accident prone, things happen, sports, lots of concussions. When they eat MSG, when they eat inflammatory foods, it's going to reinstate that concussion syndrome at the time after that food. So they're going to relive that concussion over and over and create more damage? It's
worse than you're saying. Okay? Because you're saying it's reinstating it like, okay, it's where it was. Now, when you know about neuroplasticity, neuroplasticity is the cell learns, the cell grows, the cell gets better, it does its job better. Well, the cells that make inflammation aren't supposed to make inflammation unless it's absolutely drastic, right? Because the pH level changes within the brain with inflammation destroys the brain. So in trying to build it, it's killing itself too. So it's very careful on when it allows it. Well, those cells are called glial cells. They're the same cells that if you've got, the nucleus of the cell, and then you've got the axon, and the synapse, at this end, you have these little cells that are coding on the axon. And what's really cool about it is it speeds up the nerve. See, the faster I can fire, the more I can do refined things. I could fire 5 nerves at the same time, and each one could have a different amount of the glial cells and the efficiency of the fats that are inside of it and all of that, and they won't hit at the same time, right? They'll hit 1, 2, 3, 4, 5, right? And that will allow new things to happen that are more refined and more advanced, which is really cool. Those are the cells that make inflammation, glial cells. Well, once the glial cells experience and make inflammation, they learn. We don't call it plasticity, neuroplasticity. We call it glial priming.
So we're building bad things.
We're building that cell to know how to make inflammation. And each time we do it, it's at a higher level and it's jacking up.
We're getting better
It's
at it.
priming, yes,
Okay.
more efficient, just like the neuroplasticity is getting more. And so when I want you to see that when I go to Panda and I eat, it's like getting hit with a baseball bat, because that if I got hit with a baseball bat and that's how I got my injury, it's like that happening again, but the cells are going to do even better at creating it. And so that's the vision of how bad it is. And so keeping it from having that happen is paramount.
Do you have a list of personal foods that incite brain inflammation?
All of the artificial sweeteners, all of the stuff that includes neurotransmitters in it, particularly the excitatory. From a neuroscientist, point of view, I don't believe that there are excitatory neurotransmitters. So let me explain that. Yeah, okay, it creates excitation, but I feel like all of them are excitatory, but they just do different things at the end. So, like, let's say the most common excitatory neurotransmitter in the brain is glutamate. When it fires, it's going to go through immediate early gene response. It's going to fire the nerve, you're going to get that signal. And what's cool about those glial cells, it doesn't have to go all the way. It basically is going to, the charge is going to go to that cell and hop to the cell. We call it saltatory conduction, right? Kangaroos are saltatory, the animals, and so it's hopping, which means it's skipping and going faster, right? Well, the process of firing that nerve causes it to give off a neurotransmitter at the other end for whatever it's touching, and as it does that, it's going to excite that nerve to do something. If we call it excitatory, like glutamate, it's going to cause it to immediate early gene response and fire and reset for the next one, right? But if it's GABA aminobutyric acid, which is the most common inhibitory neurotransmitter, it's going to fire, but it's going to, when it sends that neurotransmitter to the next cell, it's going to cause it to only do immediate early gene response, not fire, and not have to reset. Okay, so for me that's still excitatory because it causes the cell, and I use that especially in very fragile, I'm talking really fragile circumstances. You got damage in the brain, and I know I'm going to have to work with that area, but when I work with it, because it's so recent and so acute and horrible, if I do it, it makes it worse because I'm kicking it off even worse. So what I'll do is I'll come over to the other side, and if you fire, you inhibit. So now I'm firing here to inhibit here to cause it to only go through immediate early gene response, which causes the cell to get well faster, to heal and become stronger. And oftentimes, when I start doing that, within days, I can start, working on the damaged area or the severely weak area.
So every time you have Panda, you do this inflammation, then you have to recuperate and recover all of these neurons, not only in the brain, but it also affects the rest of your body.
Yep.
So you can tell, like, old sports injuries are going to hit
Yep.
worse first, re-injure, and then start brain damaging to the good parts of the tissue.
And the predilection towards the injuries that I tend to get because of the weakness that created. You can't, how do I say this? A tenet of functional neurology is that any peripheral stimulation will always have a central effect, and every central effect will always have a peripheral manifestation. That's why I said I use walking a lot, I use talking a lot. Why? They're the most difficult. They take the most different kinds of things within the brain from every corner of the brain. And when I see something, and when I see somebody walking, if they've got a problem, it's coming out to the trained eye, right? Mm-hmm. And so anything that I do that would reconcuss me is going to come out radically in so many different ways to whatever it's affecting. And in my case, the brain injury is large enough to where I have immediate personality change. Why? Because it's a predictor mechanism, and that predictor mechanism is the personality. When we damage the predictor, we affect the personality. You can't not, right?
Okay. So if you're someone with a brain injury and you continue to drink alcohol, you've got alcoholic dementia, you're not drunk at the time, you seem fine, you seem well, everybody's like, you're fabulous. 10 minutes later, you're not well, you're repeating a cycle, then you keep drinking, you forgot that you're not drinking, and you start drinking again, and the cycle continues and worsens. What are the expectations of that? Can someone recover from a situation like that? Can brain plasticity heal all? Or is there a point where it's...
There's a lot of new stuff on that. There's a lot of new, especially with neurotrophic factors, and that they like to play with stem cell. Which, hey, I'm not against stem cells. I've got a buddy who does stem cell a lot. I've tried to get with some of the stem cell people and say, hey, I've got some information that you don't have that I believe would be helpful to you. Stem cells are undifferentiated cells that we're trying to put in an area and cause it, to differentiate into whatever cells we want it to do a function. And, my comment is, guys, you're just throwing them in there, right? Let's prepare the ground. Kind of like my grandma taught me how to garden when I was a kid. Well, it kept me out of jail because my brother did go to jail, right? But I learned by experience, prepare the ground. Whenever I moved the chicken coop, that was my garden, right? I got the best garden in the whole place, And so preparing the garden, getting it ready, getting the fertile ground, but also working with the blood flow, right? If you have a business where you live and it's dependent on your community and you're doing very well and you were to move it here, right? How well would that thrive when you get started, right? It would be incredibly difficult to get it going and that. But let's take it one step further. Let's say you've got a business and it's kind of weak because of the economy. Not that there would be any reason for the economy to be bad, right? But it's bad. And then you take it and move it. Disaster. And that's what oftentimes they're doing is they're throwing stem cell and they're not thinking, let's prepare it. Let's get that area more healthy and strong. That's on that side of it. Then I say, okay, let's say we prepared it, right? Peradventure, we did all that we could do.
How do you prepare it? What is it preparing? Fertilizing that?
I'm going to work with everything around it. I'm going to work with the blood flow so that I improve the blood flow. And when you say blood flow, we're talking not just veins and arteries. We're talking about capillary beds. We're talking about operating those systems so much that the capillaries become more efficient, not only more pervasive, but more. In the scientific language, we're talking about perfusion rates, right? We're getting that perfusion to work better, so it's more efficient. Then we're going to work with all the cells that are around it, because as you found out, right, when we change the the frequency of a low running neuronal pool, it affects everything that's around it. Well, everything around it, the corollary is everything around it is helping it. And it's doing the best it can, so let's bring it up. So let's work everything that's around it so it operates at a higher level before I put those in. In the case of Parkinson's, the reason why it never works, ever, they're going to put those stem cells in the substantia nigra, in the brainstem, which is up there in that medulla, right? And this is why it doesn't work. That's why it doesn't work. 100% of those with Parkinson's have a severe head forward posture, which is stretching the cord. You stretch the cord in the brainstem. If you stretch a rubber band, does it get thicker or thinner? If you stretch a spinal cord, thicker or thinner?
Thinner.
That's what Alf Briggs says, Nobel laureate, right? He's one that I've read all of his stuff, and that you stretch the cord, you decrease the blood flow. That is a major reason why they're having the problem. You put the curve back in, the blood starts to flow, they automatically do better. I have a Parkinson's patient that when I started, when his eyes closed, he couldn't get them open. I mean, he would even pull them up and they wouldn't open. And I lay him back on the molds, and all of a sudden his eyes go.
Wow.
How did that happen? Blood flow. And the phrase we use in here, and to all my docs, blood flow always works. I had one of my very advanced doctors, he's in San Jose, and I have him yell it, blood flow always works, blood flow always works. And then he asks, Adam turns and says, does it always work? And I said, you're asking a different question. You're asking if it always takes care of the symptom. I didn't say that. What I'm saying is, when you have an area that has a decrease in blood flow, health of that area goes down. And when you increase it, it goes up. I didn't say symptoms would be eradicated or even modified at all. But I'm interested in the health of those tissues, because the health of those tissues leads to the behaviors that they're able to do and the endurance of the ability to do those. And he goes, oh, okay, I got that, And that Monday, I love teaching these guys because they have things to do on Monday, And he calls, I got this on my cell phone, this message. He said, Dr. Elmer, and he screams, blood flow always works. I'll call you after work, And he calls me after work, and he says, hey, I had this case, this kid that I'm taking care of, and he brought his buddy in, and he's wearing this brace on his leg because 2 years before he fractured C7 in a car accident, and it paralyzed that leg. And I told him about what we had talked about, and the blood flow and getting blood flow through the molds, getting that curve back in. And he said, you want to try it? Yeah. The other kid was going to do some molding anyway, so they laid him down on the molds. And he says, and I went about my business taking care of patients, and then I hear a commotion, and I finished up and go over and said, everything okay? He goes, yeah, I can feel my leg. And so he says, I reached down and touched it. His shin was exposed, and he, partially, and he put his hands, he says, I can feel your hands on my shin. I go, wow, that's cool already. And he goes back and gets started again, and all of a sudden he hears another commotion. He goes back, says, what's going on? He says, I can move my foot. And so he goes and gets a gauge to determine, the amount of pressure. And he says, okay, pull on this gauge. And he pulled on it, 47 pounds of pressure after 2 years of not being able to move that foot.
Oh, that's impressive.
Pretty dang awesome, yeah. And then he yelled, blood flow always works. I said, it is so nice when it also is accompanied by, the symptom changing. That's very nice. But yes, it always works. And so now that we've done that, now that we've prepared the ground, you've seen that kind of vision, now we're going to step over the threshold of we've put them in there. And we want them to be able to grow. So we're going to ask those behaviors that those cells are supposed to differentiate in. because here's the vision. I want them to become like the other cells in the area. So I'm going to stimulate that area to do work, but I'm going to be watching, right? Fatigue, you're done. So I'm making it work, making it work. I want those cells to become cells just like their neighbors in that area. Okay, now they're doing it. Now I got to step up their pace so that they're as good as the ones that are around it. You see that? That's another level, right? Then I'm gonna make sure that I'm gonna do alternate behaviors that are gonna work with them being able to work in harmony with other areas to create other behaviors that they're involved in. Can you see how complex that all is? And they're just going, oh, it failed. Yeah, well, that's like throwing some seeds on the ground and saying, it didn't work. I didn't get a garden. I say a garden takes a lot more before, during, after. So that's the moral.
All right. And the blood flow, the blood must be quality blood.
Yes. And
Food,
the greater
exercise,
the quality, yes.
Oxygen.
Yeah. Yeah. And but I want you to see also, because I hear this all the time, what if, I've got this little kid, he's autistic, and his mom, what if I take him, into the oxygen chamber? Oxygen chamber is going to make all the cells in your body work a little better. A little, right? But it's not going to force them to have to make more mitochondria. It's not going to target the cells that actually need to change, right? I want the ones that need to change. If we're doing the chamber and doing the working to change it, okay. That'll actually make my job probably work a little better, like laser, with the same idea. Because there are plenty of those that are saying, yeah, autism, well, we got a laser, let's do it, And they don't even know where they're shooting at. They don't even know what autism is. What is autism? Dr. Malilla, who's my current mentor, he's in Autism 1. He's the number 4 guy. The 3 ahead of him are Nobel laureates. Right? Why is he not a Nobel laureate? He's a chiropractor. He'll never be a Nobel laureate, right? He doesn't care. He invented a system that everybody else is following, right? The Nobel laureates are following him. But he's up there talking, and all these doctors, and these are the best researchers, the best people on the planet for autism. And he's up there and he goes, can anybody tell me what's happening in the brain of an autistic kid? Why are they autistic? Anybody tell me? And it was crickets. And he says, then why are you treating them the way you are? If you don't know, get out of the way and let the adults take care of this. And I mean, these are the best in the world. Nobody wants to catch up to the science.
Nobody wants to do the work.
Nobody wants to do the work. And nobody wants to stop making the money they're making. The number one group of medications that are in this country are behavioral meds.
A big problem doctors tell me is, I say, why don't you tell me about food? Why didn't you tell me to get on Whole30? Why did my brother and sister have to tell me to get on Whole30, And he says, because the majority of people that come in here do not want to do the work. They do not want to do it. Don't tell me I can't eat my panda.
Right.
Don't tell me, give me the pills so I can live the life that I want to live. But when they get to a certain point, the meds are going to quit working.
Yeah.
And then all hell is going to break loose, and they're going to be in a suicidal situation.
Right.
Their family's going to fall apart. They're going to go into bankruptcy, and they could have prevented it had they just listened and said, take care of yourself. A little bit of prevention goes a long way.
Oh, yeah.
People don't see it's coming.
Yeah, but you can't fix stupid. That's just the way it is, and that's why I don't market. Especially, I don't market. I'll be up talking, and somebody will be arguing with me, and I'll say, listen, I'll answer your questions. I love questions, and I love true. I say, well, I'm skeptical. I love skeptical. True skepticism is, I'm going to be picking this apart and trying to understand it, but you'll be open to other possibilities. What you are is you're religious, right? You have a dogma, and any evidence that would go against that dogma is garbage. I said, if that's the case, you need to go somewhere else, because I'm going to be teaching this certain stuff, and if you're open to it, great. If you're not, you don't belong here. And so I quit trying, I'd say, are you interested? Yes. I go a little while, I start talking, and I could see them shutting down. I go, yeah, that's all right. Any other questions? Okay, there we go. But almost 100% of my patients come from other patients.
If you had a bunch of doctors that hear this and they're willing to come to you and want the truth bombs, how do you work with other doctors? Are you willing to work with other doctors?
Are you talking about like medical doctors?
Either, anybody out there that wants to learn some stuff and improve their, their chiropractic, their physical therapy, everything.
I've been teaching, since I started Pedabon 28 years ago, and I would say in 4 or 5 years I was already an instructor for them, so I've been teaching since that point. Have I taught PTs? Yeah, I love teaching PTs. These guys are already well versed in certain things. They have to be super open, because just about everything I do is opposite of what they're doing. If they're open, many of them have already found other guys like me, on the internet or whatever, and who had Gray Cook. Oh man, I love this guy. He's the only PT I listen to. And when I listen to these guys, I'm listening, I go, what do they know from a neuroscience point of view? And I listen and turn it off. But with Gray, I'm listening, hey, that follows this principle. And then he said it, I went, oh, brother. I've got all of his books, and I plan on someday actually going through his program, and that I use a bunch of his stuff. But when you find that kind of guy, and those PTs that are open, when you say Gray Cook, they already know him, probably. And if they don't, they'll love him, And I love it. And I've got some medical doctor friends. I've got a couple of medical doctor friends that I consider they are with medicine, me, right? They think with medicine, which is really cool. They're not, and they're always getting in trouble, right? What was the one guy, the one doctor? He got in trouble from the insurance company for prescribing Viagra to a woman. And they're sending their experts, and and they're doing this investigation, and he's sitting there waiting for them to finally ask him a question. And he goes, Viagra is a vasodilator, and she has a severe heart issue, and I want the vasodilation within the heart. And when she takes it, she does a lot better. Why don't you ask the patient how she feels about it?
Yeah.
And they don't care. They won't ask. They'll well, in my manual it says, I say, yeah, well, take your manual and I bet.
That's something you told me was, any tool that's working for you, do it. Anything that's the things that I have wonderful physical therapies, they did not know, or therapists, they did not know anything about dystonia, and they went and educated themselves.
Good, I love it.
There's not any education teaching us the things that you're doing,
right?
And not even in the dystonia world. I'm a member of 3 different dystonia support groups, and not one of them has given any of this option, but they all have given me meds, Botox, and in fact, every single month is a new Botox doctor at our thing telling us about this new medication, and Botox a little bit better for you.
Yeah.
But these are some of the things that my physical therapist, these are things that have worked for me in the past.
Yeah.
And I mean, they save me. They save me, especially with their just touch me, that hands-on, that connectivity, that is all the help, better than anything.
Yeah.
But yay to all of these things.
Yeah. Love these. I'm going to give you a little one to put in your mouth.
Okay.
That's great. What do you use this for?
Head, you lay on it and you do the neck exercises.
Okay, good. I like the elasticity.
And I do have the bands too, but I thought, I'm going to walk in here and you're going to have the bands, you're going to have all, no. This is
I
totally
do have
backwards.
them, but I bring it out when I need it. Because and the reason that happens is because I've got like a jillion different tools, and I'm constantly, well, I could use that for this, you know, and so I do use bands. When I look at bands, I say most people are using them like when they work out with weights.
Yes.
I say, different. It actually has a different effect. And what am I trying to accomplish? Like, let's say you got somebody with a rotator cuff, right? Rotator cuff problem. Why do they have a rotator cuff problem? They're the stabilizers. And because they're the stabilizers, if they don't do their job, then the bigger muscles are going to overpower them, right? You see that when you got the guy who played quarterback, and then 20 years later he decides he wants to go out and play again. So he goes to the gym and he gets really big and really strong, maybe even stronger than he was before. But what is not getting stronger along with it? The stabilizer system. They've lost ground. If you don't use it,
you
lose it. Exactly. And so now they're going out, and he's doing great things, and he's recalling patterns neurologically to do things in a really efficient way and to avoid injury. But his stabilizers can't cash the checks, right? Can't stabilize him while he's doing it, and he injured it. You know, and I just love it. Well, I went out and I hurt my rotator cuff, and I said, "You're surprised?" You know? Yeah, and even my doctor was surprised. What's gonna give, right? The stabilizers. So when my workouts for me, I mean, I'm a blob, but my workouts for me are almost completely stabilizers.
Okay.
And for more than one reason. I mean, I'm a martial artist, and so I want to hit them. I want to hit them with a mountain rather than with a bumper of a car, right? But even more than that, those stabilizers are the primary driver of brain activity. The central integrative state is dictated, remember those 400 million nerve fibers? Those are all stabilizers. And so the more I jack those babies up, which is actually jacking up the cerebellum and the midline stuff and that, the more we build that up, the more my brain operates at a higher level all the time. That's the real reason.
I can feel the difference.
Yeah.
I can feel everything tightening up.
Yeah.
My back is straighter. It was laborious.
Yep.
It was laborious to stand up. It was laborious to walk. It was laborious to walk to the bathroom and back. And so now I feel like human. I feel normal. I feel, it's coming back.
Yeah.
So one thing that you talked to me about the other day was a brace is great only in a certain short situation, because how much muscle mass do you lose per?
1 to 1.5% of muscle mass per day. 1 to 3% of functionality per day. And so I am so sparing with braces. I'm sparing even with sleeves. Now, if I fight, I wear a sleeve on my right knee because I had for decades I had only ankle injuries, and I did so many bad things to my shoulder with college sports, you know, with javelin and shot and disc and that. But that knee can get injured fairly quickly, and I kinesiotape it to tighten it down a little bit, and then I sleeve it, and that. But that's it. I don't even put a brace on it ever.
And that's just while you're in play.
Yeah, and that's only when I'm getting kicked on.
Okay.
Okay. I mean, when I say if I go work out, like let's say I work out on the bag or work out on Bob, I don't have it, right? And then I've got a whole routine to stabilize my knee, to toughen my knee, and it's always the opposite of what everybody else is doing, right? They're doing this, I'm doing this, right?
Yes.
I'm doing the opposing muscle groups, because the real stability, I said, when you're throwing something, right? The thing that keeps your arm from coming off with whatever you're throwing is the muscles back here. The thing that gives the stability for the throw is back here, not here. And my buddy I'm working with, he's a professional fighter. I mean, he's a Samoan, and he grew up in New Zealand. Big, I mean, he's a mountain, and his shoulders are like this. And his shoulders have gone from here to here. And he said, yeah, I get pain here, right? I get pain here. And so what did I teach him? I taught him how the corner,
Yeah. Oh, yes, the
right?
corner.
The reverse push-ups,
Yes.
right? I said, you need to be working these, and we got him doing rotator cuff exercises. And the rotator cuff exercises, he's going to be doing this. Well, there's 2 exercises. I'm going to be doing this with a weight, okay? But it's only efficient to about here, right? He's going to be doing those rotator cuffs, and part of it is going to be holds. Not just movement, but holds, because stabilizers are there to be endurant. And then we do a band from here to here, right? And then we're doing reps and then hold. And so it's completely different, model from what everybody else is. We've also got a little toy that forces rotational stresses, and it's just real basic. It's just like a ball with string, but it's got weight, and you're spinning it in different planes, and it's forcing the stabilizers to lock down, and so it's a different model.
That makes sense. This is a neck pump that I was given by a chiropractor that I adore. He works with the spurs. He's fantastic. But I've been doing this, and you've seen my neck curve. I have not had improvement. However, since I've been doing the Peloton system, I noticed that I have to do this, the lower back and the knees. This I just lay down, and I've just been doing it. So that's probably why I have not been seeing results off of this.
Throw it out.
Okay.
No, that's all right. You see, it's in the model, right? It's in the model, but it doesn't fit in the model of true structural correction. I showed you the 3 tissues that have to change: white tissue, red tissue, nerve tissue. This is trying to work with the white tissue, and it's trying to open it up. But because it's a harsher stretch, it's not self-limiting, you're going to tear the tissue.
So I'm making it worse by doing this?
Which makes it more unstable, right?
So I've been stretching my back and my neck.
It's like a car accident. Okay, that's what happens. You take that spring and overspring it. There are chiropractic systems that are trying to make the X-rays look better, right? Like I do, and they're trying to change it, and they feel like the change on the X-ray is the outcome. For me, it's not. It's the function. It's the stability. I want you doing more. I want you to be able to be a triathlete when I'm done. And you say, well, I've never been one. Yeah, but I want you to be able to, and I've already done that, right? We're taking the tissue and allowing it to slowly open up in a self-limiting way. And this, the more it's, a harsh stretch over time, the more it creates what's called permanent plastic deformation.
Is that what I have?
Yeah. And several of these systems that like to do it that way, they come in to see me later after they've been seeing them for a while, or it might even be several years after. But they come in and I throw their X-rays up. I'll take X-rays and I'll throw them up, and I say, you had a traction unit that pulled on this and this and this. And they go, how do you know? I said, that's where the degeneration is, and that's where the damage is, and that's where the instability is. That's all right.
Okay, so we're doing
But to their defense, better than surgery.
Yeah.
Right?
But
So.
bye.
And people don't like what we do, what my system is, because it takes longer.
And because it's cheaper.
Yeah, no kidding. Yeah.
However, it is out of pocket. It is not insurance covered, which is a problem. And the reason it's not covered by insurance is because there's not enough studies that prove that this works. So if we had people like with money, like pharmaceuticals have money, that were investing in studies that could prove to the insurance this works, insurance would cover it. That's the problem. We are the problem. We keep buying the bad stuff, and we're not subscribing and putting our money where the good stuff is. Until we make differences in ourselves, the people, it's not going to change.
What else would you like to?
That's it. Unless there's anything else you want to talk about here. I have an inferential unit.
There's a lot of stuff we can do with that.
I haven't even been using it.
See, and what we would be doing with it is different than what others would be doing with it. We can use it to stimulate. We can use it to increase function, in a nerve with nerve muscle integration. but we can also do what we call tetanyzing current, where it's holding, which that's more an endurant type thing. So, that's really good. They're going to want to put it directly on where the pain is. I'm going to be putting it somewhere else.
Okay.
And you already know what I'm doing for you with a TENS unit.
Mm-hmm.
We're doing a therapy on the ear clippy that's going to hit cranial nerve 10, which is going to significantly draw back seizures, decrease anxiety, and cause the cranial nerve 10 system to function the way it's supposed to.
You said anxiety. I have to ask. Substituting, I've noticed in different communities, there's a plague of children from COVID who have anxieties off the chart. Teachers are saying, it's okay, this little girl is going to have a meltdown. Let her go to the corner, she has a place to melt down. This little boy, he may just get up in the middle of class and just leave. He knows he's gonna go to the library and hang out there. This little girl, don't make her do math, because it's just making her melt down. All of these kids are enabling. I feel like they are being enabled.
Yes,
like you're just going to allow her to have her tantrum temper instead of explaining to her why it's best not to have one and give her tools to express instead of just letting it happen. So what are we doing for these kids now?
Well, we're not doing anything that is going to be improving the circumstance at all. If anything, we're doing things that are going to make things worse. Why are they having a meltdown now where they didn't have meltdowns before COVID? Because they were building their brains, and school was a part of that. The inputs, and I'll show you in just a second, where do you put a kid in the classroom, right? So that his brain is growing just by where he is in the classroom, right? There's a social part of your brain, problem is area 9, we've talked about that, and it grows through activity. It's the same thing as why are people getting sick now? When we were keeping them, sequestered and that, quarantined and that, and you'd think that they would be healthier now. No, they're sicker. Why? There's a thing called immunological load. That's basic. The concept of what I have happening to me from my environment dictates how tough my immune system's going to be. When I reduce that, my immune system gets weaker. Oh, that's what we did. Well, I'm not saying it's a conspiracy, but I'm saying it's a conspiracy, right? They created a weaker, sicker generation in all of us, right? They created that monster, and now if they do something like they did last time, it's going to be even worse because we are sicker and less able to fight. Well, it's the same concept with the brain. We're in school, and a major part of what we're doing is developing the capacity to socialize, to tolerate socialization. When you first start socializing as a little kid, man, it's highly stressful, and you literally have to hang in there to force yourself to be able to take it more easily. I worked with a young kid, and he was in trouble. The day she brought him in, he had been kicked out of school for punching a teacher. He was 6. And so we started working with him, and we progressed him, and he would, meltdowns and explosions and no social skills, and we got him quickly to the point where he could go back to school, and I went to his school and sat down with the teacher and then the principal, and okay, here's what you're going to do when this happens, and that. But we get him, we progress him to the point where he's now the class president, and I mean things are going so well. And I sat down with the mom. It was the end of a cycle of care, and she said, "What else can you get me?" And I said, "We could stop now. We're at a point where he's got, and he's pretty much like the above average kids in his class." I said, "But everything that we've gotten him, I can make all of those things come with ease, greater ease." And she said, "I want that." And so we kept working with him for a while longer, and he does great. But that capacity to handle groups, that's why, let's say, I just can't handle groups. I can't handle being in, situations. I can't handle conflict. And what they're saying is conflict is like nothing compared to what they used to deal with on a regular basis. Well, they've lost the capacity. If you don't use it,
you lose it.
You lose it. It's a basic law of biology. Grow or die. That is the model. And we should know that, but apparently they're rewriting science for us without the research to back it up.
Do you have advice for a teacher that's just overwhelmed with these children in their classroom? Is there something that they can be doing in the classroom?
I would get them moving, man. Get these kids moving. When they're freaking out, get them up and moving. Yeah. I had one teacher I was teaching. I taught a lot of groups of teachers, and a lot of them are very intuitive. This one lady said, "Well, I'm not a neurologist, but I brought in a swing." And if a kid was kind of freaking out, I'd kind of have him come over and get in a swing, and I'd, wind it up and let him spin out of it and wind him out. I said, that's brilliant. That is the most powerful reflex you've got. The most profound reflex is that spinning of those head sensors, right? And so it has the most powerful impact. The only thing I would do different from what you did was I would be selective on the direction. Right? You went either direction, which is not bad, right? But I'm trying to fix it, and it's one-sided, so I'm going to go only in that direction. So when you're doing it out there, you're doing way higher science than anybody in your city.
That's amazing. How you find when my brain is, where my brain is hitting, is you have me stand on one foot. If I fall forward, if I fall back, if I fall out, if I fall in on each foot, that determines what part of the brain that you're going to work on. So okay, everybody, we're going to stand up, we're going to stand on our right foot, and everybody's going to figure out where they're falling. We're going to stand up on our left foot. Now look at your thumbs. Now do it again. And if you had the whole classroom do that, and they could go, oh, I see, I'm activated here, and they're self-educating, and now we have a protocol. So now, if you are here, and then you've got the patterns on the wall. If these are your brain pattern, this is your brain pattern, this is your brain pattern. Is there something that they can do? You're going to put peppermint up your nose. You're going to do this. You're going to do that. You're going to pull your fingers. You're going to draw an 8 on the back of your neck. I mean, it's the craziest things. But yet, you've proven to me that they have all worked.
You feel it.
Yeah.
Let's go to the whiteboard here real quick and